Hi class, my name is Lauren Bowder and my project proposal is Educate to Eradicate, which serves to educate young women on the dangers of fetal alcohol spectrum disorders. So this program will hold a total of 4 educational assemblies all across Anchorage. So a little bit of background, what's the big issue with fetal alcohol spectrum disorders? It's been estimated that it costs nearly $4 billion annually for the US in healthcare costs. Fetal alcohol spectrum disorder is 100% preventable and it is 0% curable, so making sure women are educated is a really important part to help prevent this disorder from occurring. And as you can see on this map here, this shows the binge drinking rates for different states, and as you can see, Alaska is among the highest. Women between the ages of 18 to 24 have the highest rates of unplanned pregnancy, and typically fetal alcohol spectrum disorder children are seen in unplanned pregnancies, so for that reason, that age range between 18 to 24 is going to be my target audience. So what to do about it? Prevention is key in addressing the issue before it really begins, so we really want to work to educate women on the dangers of exposing their fetus to alcohol and also the ways that they can prevent this from happening. So my program really focuses on the physical aspects, the cognitive aspects, and then the financial repercussions. It's also based on the information motivation behavioral skills model, which takes into account not only educating, but also figuring out what motivates the women and what skills they need to develop to create a lasting effect. Because knowledge on an issue is a really great starting point, but without a desire to change the behavior, the program just won't be as successful as it possibly could. So the problem statement is as follows. Basically, fetal alcohol spectrum, it's an irreversible disability and it can have a lot of different traits that mark it, whether it's physical or cognitive, and they also can really vary on the severity of it. So educating is an action that really needs to be taken because this disorder is 100% preventable. So the specific aims of this program are to take educational meetings to create a behavioral change. The goals are to educate the women on the dangers of exposing a fetus to alcohol, decreasing the number of fetal alcohol spectrum disorder cases in Alaska, and then increasing community awareness on how to prevent this. So there's a lot of partners that we're going to be contacting to try and help us out with this program. Anchorage School District and UAA are going to be 2 really big ones because they'll be the areas that these assemblies will be held, as well as how we'll get in touch with our target audience. The Fetal Alcohol Spectrum Disorder Partnership, as well as the National Organization of Fetal Alcohol Syndrome, are both programs that are already up and running, and so these will be really great tools because it will help us to figure out which ways they have found to be the most effective to communicate with our target audience. Also, local health providers will be contacted to help with advertising, as well as they would be able to have some of our brochures in their office so that women as well as their families could obtain these not only at the sessions but also at their local healthcare providers. Also, Anchorage Dispatch News could help with the advertising for these events, and then the UAA Copy and Print Center would be key in getting all of the brochures and materials and posters printed up to go around the community. And then Kaladi Brothers Coffee Company, this would basically be requesting them to provide 1 free coffee a day during the sessions for our volunteers, just as a simple way to thank them for their time. So the planning to educate to eradicate, there's 3 different steps here. The first one is the staffing. I really think that the team aspect of this is going to be really a key point in making sure that the program is successful. So we're seeking 1 physician as well as a health educator and then 6 volunteers. So the physician will help to provide a lot of the accurate data and do a lot of the background work with the curriculum. And then the health educator will be key in figuring out how to best communicate and convey our information in the most effective and efficient manner. And then the 6 volunteers would be there to help with the planning stages as well as to be at all of the events where they could greet participants at the door, hand out brochures, answer questions, and do some follow-up surveys with the women as well. So where would these be located? They would be located around all the different schools in Anchorage, so at 4 different locations, kind of targeting one in each major area of Anchorage. And then the materials that we will be distributing include posters, brochures, pamphlets, and then promotional materials. So the events of Educate to Eradicate, there's some things that we would be doing prior to this, such as pre-testing. So part of this would be the volunteers going to local schools and conducting a survey to figure out when the best time and dates would be for these women to attend. Also distributing the brochures, hanging up posters, and a lot of the advertising would all be done before the events. And then at the actual sessions, we would have a welcome and then a pre-assembly survey that the women would take to basically determine how many of them actually have partaken in drinking alcohol while they were pregnant or if they were pregnant, as well as just a baseline of their knowledge on fetal alcohol spectrum disorder. This would serve as kind of a baseline. Then we would have our PowerPoint presentation and then a question and discussion time where the women could voice any concerns or express any ways that they may need help. And then we would conduct another post-assembly survey. All of these surveys would be completely anonymous and just a checkbox type answer. And this would help to determine what the women actually learned at the event, so what information was relevant and how we were, if we were being successful in our educational methods. And then also there would be a follow-up phone administered survey which would take place 1 month after the women attended the events. So this would just kind of be a follow-up to see if the changes were still lasting, if they still had those same feelings and views on drinking while pregnant. So the measurement of this program is based off the Pregnancy Risk Assessment Management System, which is also known as PRAMS. This also has been used before to evaluate a fetal alcohol spectrum disorder prevention program in Washington. So it just kind of takes a lot of those questions and puts it into a form that's easy for the women to fill out. As I said, there's also the pre-assembly and post-assembly surveys which the women will take place. And then also we would conduct just some randomized face-to-face interviews at the events where just women could be contacted and asked a few questions in that face-to-face setting just to help provide the most accurate data as possible. And then also the phone intervention survey, which would be administered 1 month after the women attended the event. So here's a breakdown of the budget. As you can see, a lot of the costs we are requesting are going to go towards the personnel of the program. I really think that the physician and the health educator are really key in making sure that we have accurate information and that we're conveying the information in the most effective way possible. I also think it would be important to include childcare so that the women don't have to worry about setting up and facilitating who's going to take care of their children if they are to attend these events. And then the printing is also a large portion of the budget for all of our brochures and posters, promotional materials. And then for the in-kind contributions, like I said at the beginning, the volunteers were requesting that Kaladi Brothers would contribute 1 free coffee per day for them. The equipment, we're requesting that the Anchorage School District would open up their auditoriums for the events to be held. And then also requesting some funding from the UAA printing services for just the remainder of any information that we needed printed, as well as some of the promotional materials. So here's a timeline of what we're expecting with this program. So beginning in June, we would start to contact the staff and conduct interviews for that. By the end of June, the team would be finalized and we would begin training on the program and the educational information. In July, the goals and objectives would be outlined and then agreed upon. The staff would be also included in this process to make sure that everyone's ideas and opinions are considered. And also a needs assessment would be done just to make sure that our goals and objectives are really in line with what we're wanting our overall outcome to be. In August, the partners would be contacted and informed about Educate to Eradicate and our overall mission. And then pre-testing would also be done on when and where the programs will take place through the use of surveys. Since school will be back in session, the women would be contacted either in a high school or college setting. So it's a really good timing for that, just to make sure that we're reaching our total population. Then September, the first 2 sessions would take place, and then in October, the 3rd and 4th sessions would take place. Also, they would begin doing the post-program phone-administered surveys. And then in November, they would complete the rest of the post-program surveys as well as collecting data for the evaluation. So I hope you guys enjoyed this, and you can see why preventing fetal alcohol spectrum disorder is such an important thing that needs to be done all over the place, as well as here in Alaska. Thanks, guys.